Wells Plastic Surgery Skincare Program with 2 advanced nurse injectors. Wells Skincare Program offers the latest injectable services from Botox to sculpture and beyond. Welcome back to the show, my friend.
Well, thank you.
So nice
so it's good to be here.
I love it when you come in. Look, men, Father's Day is coming up. I'm a believer in everything when it comes to injectables or anything that men can have done. But what are men doing the most when it comes to injectables and fillers and things like this?
Well, men are all generations. We have boomers, Xers, millennials, and the thing they do most is Botox and Dysport.
Really? So let's talk about the Dysport to begin with. What does the Dysport do?
It relaxes muscles, which makes the wrinkles go away.
Okay.
And I think we have a graphic. We have all ages. Actually, it does hit all 3 generations. And the first graphic we have is a Generation Xer.
Really? Okay, so talk to me about, is this the before and after?
Actually, this is our millennial.
Oh, wow.
And actually, millennials are the biggest growing group of men coming. Now, this is somebody who had just familiarly active eyebrows.
Well, yes.
And
he's an eyebrow raiser.
He is an eyebrow raiser. And he also had some acne scars within those lines that kept them very deep. So this is a Dysport patient.
Wow.
And I ran a little soft Restylane Silk within some of those acne scars. And this is him actually animating. He sent me that selfie back from college.
You were talking about millennials and X generation and Y generation. What's a typical man that's doing it? What's the age bracket nowadays?
For Dysport and Botox,
Yeah.
I would say they typically come in closer to their 40s.
Oh, really? Okay, because I'm a believer in prevention, and I started late 20s. And is that a little bit too early, do you think?
Absolutely not. In fact, that was a 26-year-old.
Oh, we love that.
And
Okay.
the girls are actually coming earlier, but the men usually arrive because some woman in their life has pushed them to get there.
Men. It's the women that tell the men to go and do it, or they're competing in work.
Or in the place of love.
Oh, wow.
Those who are looking to
Father's Day,
connect.
everyone. I want to talk to you about laser hair removal.
Okay.
Now, I haven't done that because I thought it would hurt. Talk to me a little bit about that to begin with.
It's just a little snap.
Is it? Well, I was told it's a bit like a rubber band.
It's like a rubber band.
Okay.
And actually, for injectables, we put a numbing cream on, and we don't do anything for this.
Oh, you don't even do numbing cream?
We don't even do numbing cream. It's
And
very doable.
Is it still, we're looking at it before and after here. How often would you need to be having laser work done when you look at a patient like this?
Someone like that probably needs to count on 5 or 6 treatments about a month apart, and they need to really stay on schedule to get a good result.
Really? So how many treatments did you say?
5 or 6, and the guys do this not only for aesthetics, to look better, but in the summer they're so much less sweaty.
Oh yeah, I can imagine. Do you see men starting to have their dermal fillers done a little bit sooner?
Actually, we have not. Men typically don't have fillers until maybe their late 40s, mid 50s, where they get hollow in their face. They've lost weight. And that revolumization makes them look much more young.
Is it true that if you exercise
Yes.
very heavily in your life, that the fillers and Botox don't last as long, and they don't last as long on men as they do on women?
I think it's a metabolism thing.
Really?
That really has not, been proven in research.
Yes.
But just from observation over the last couple decades of doing this, I would agree.
Okay, I like that. If you want to find out more information, there it all is there right now, wellsplasticsurgery.com. The phone number there is fantastic. Guys, they have a really great website as well if you want to find out everything that you need to know when it comes to guys having injectables. We like it. Thank you for coming in.
Nice to see you.